Well, my first talk was about how aesthetic medicine is developing in United Kingdom. Now, as you know, with the modern advances of technology, communication, most of the treatments and the techniques are very similar what you practice in Italy and what we do in United Kingdom. But there are certain changes from a regulatory point of view that are happening. Like, say, for example, in France and some of the European countries, nurses are not allowed to do any special treatment, which doctors are allowed to do. In UK, nurses are allowed to do quite a few treatments. Say, for example, botulinum toxin, any of the dermal fillers, sclerotherapy. Even some of the nurses are doing the thread lifts. So with that wide spectrum, we need to have some consensus about how Europe should treat all their doctors, dentists, nurses, and non-doctors and non-medical people. In the next 3 or 4 months, you will see that there is a body which has been created in the United Kingdom called Health Education England. Now, Health Education England has the responsibility of developing a framework for each and every doctor or nurse, or even non-doctor or nurse, who wants to train in any of these treatments. Now, that will open a huge door for people, but at the same time, Europe is looking at it very skeptically, because our experience in France, Germany, is that not even nurses should be allowed to do it. So how can non-nurses, who are non-medical people, going to provide these treatments? The principle is very simple. It doesn't matter whether you're a doctor or a nurse or a dentist or a non-nurse. The principle is that if you are trained to do something and you're trained something to do very well, you should be allowed to do it, but that should be done under a certain framework so that all the complications can be monitored. If you are doing something that is not right, that can be appropriately corrected, and then you can continue doing your job for the best possible public confidence. Because remember, anything that goes wrong, whether you're a doctor or a nurse, it doesn't matter. Patients and the public lose faith in the profession. So it's about getting that confidence back in the profession.
That makes a lot of sense, actually.
I think it'll be a wide field, and it'll be absolutely important that we don't get it wrong from the beginning. And all the little countries, individual countries under the CEN, which is the European Union, the individual rules and regulations will always apply to that country, because as you probably know, the European Commission created the CEN-TC 403. That committee has already talked about surgery, and I think it'll be important to regulate it in a nice, in a very in-depth, and in a very country-specific way. What I'm saying is individual countries will always be different, and we need to take those little quirks into account and make sure that we deliver a safe medicine for the community. I think the culture is changing. Think about it. 25, 30 years ago, when you talked to your grandmother or my grandmother, I would have never expected them to say, oh, I want to go to the doctor to have some Botox. I want to go to the surgeon to have a breast augmentation. Today, it is completely accepted that somebody in their mid-50s or mid-60s will go and have some form of treatment to make themselves look better, feel better. But there is also another culture change. And I know very well that Italy is a very conservative country. Same as in the United Kingdom, it's a very conservative country. Turn back the clock. 25 years ago, divorce rates were less than 10 or 20%. Now divorce rates are 40, 45%. So a large number of people in their mid-40s or early 50s are looking for partners because they are in a new relationship. And hence you want to look better, you want to feel better. For a job interview, you want to look better, you want to feel better. So it's not just you wanting to do something, it's the culture wanting you to make you or look and feel better. So the numbers are increasing. But there are little things that you can talk about. Say, for example, in States, I would expect a person to have a facelift or a neck lift and be proud to talk about it with their friends. This is the amount I paid for it and this is the result. Or even we have heard of patients throwing facelift parties. So they have a facelift, it's still bruised, there's still stitches there, and they're having a party just to show it to their friends. In the United Kingdom, it's completely different.
Of course.
I would expect a lady in their mid-40s or early 50s having a facelift will try to hide away as much as possible and then come out after everything is settled to present herself as looking and fresher and looking better. And as you know, in cosmetic medicine and cosmetic surgery, you can't take everything to the extreme. You have heard of the big lips, you have heard of the big breasts. I think having something that big, which is not proportionate, that means that is not pertaining to the actual principles of beauty, will always end up with something wrong in the future. If you have too big implants, gravity will always win. And then those same breasts will need lift and other procedures. Same thing with lips. If you do too much to it, then you're going to end up with complications. And I think little and often being conservative, particularly we know cosmetic medicine is something that we want to do to make ourselves look better. You don't need to have it. It is not medicine per se. When we went to medical school, we were trained to treat somebody who is poorly, who is in pain, who is needing some form of treatment. Cosmetic medicine is not so. It is because you want it, not that you need it. So we need to be a lot more conservative and have a patient-centered approach whereby we are looking at the patient's personal feelings, what the patients want to achieve, and then if necessary, modify that to that it's too much, that let's do something that is more reasonable. And I think that is the way forward.